Hi everybody, welcome back. I'm Steph, this is PT to Go. Today I'm going to talk about lower back pain. So I've gotten some requests recently from people for some tips and tricks on low back pain. I know it's a huge problem. I myself have dealt with low back pain, so I feel your pain. So today I thought I would talk about just some very basic exercises to do if you're just like you just had an injury to your back, you've got some really acute, some sharp low back pain, and you're not really sure yet what's going on. So these are my go-tos for any patients and for myself when that back pain just starts. It's really nagging, really not comfortable. It's maybe tough to sleep. So I'm going to try and do these 2 or 3 times a day if I can, especially before bed, to try and get everything lined up so that I can sleep a little bit more comfortably. So we're not wanting to really twist or rotate the body or the spine right away after an injury occurs. That spine back into alignment as much as we can. So you want to move both sides at the same time. So they're, again, gentle. We're trying to move symmetrically and just get those muscles to shut off, get everything lined back up as much as we can right away until the muscles and everything kind of calms down, and then you can kind of figure out exactly what's going on. And I'll share in some subsequent videos here about how to kind of tell what's going on with your spine, where it's at, if something is off, what's off, and then what else you can do about it. And then after we go through some of that, the acute pain is better. Then we want to work on stability and strengthening around that core even more. So then I'll do another video about really more advanced core stabilization exercises once everything has calmed down. But when you're in really acute pain, it just happened, you want to be gentle, you want to get everything calmed down as much as you can. And I'll demo them right here for you. Okay, so the first exercise I'm going to do is called a pelvic tilt, and I'm going to call it a posterior pelvic tilt because there's a pelvic tilt you can do anteriorly going forward, but that's not what we want to do. We want to reverse the curve in your low back. So posterior pelvic tilt, I'm going to find my pelvic bones here, so the pointy bones in the front of your pelvis, and I want to tip them back, flattening my back out on the floor. Hold for about 5 seconds and relax. So I'm using my lower abdominal muscles to do that. I'm flattening out and lengthening my low back muscles that tend to get really shortened and tight when you have back pain. So we're working on aligning those vertebrae in the low back, kind of getting some mobilizing one on top of the other, how they should be able to move, and getting the lumbar spine muscles to kind of calm down and relax a little bit. So you can do about 10 reps of those. Hold for 5 seconds if you can tolerate, 10 reps if you can tolerate it. Okay. Then I like to do a knee to chest stretch, and so you can either do one knee at a time, if that's all you can. You can hold these ones a little longer, 10 to 20 seconds. And then you can switch. 10 to 20 seconds to try and pull in so you can get a stretch through the low back muscles. And then I like to get people into a double knee to chest stretch if they can. And so with this run, really try and pull in. Same thing, hold a little bit longer, 10 to 20 seconds. 2 or 3 reps of this one. Keep breathing, try and take deep breaths so you can get those muscles to really relax. Okay, then we're gonna flip to our tummies if you can. Now, if this position is too uncomfortable, you can put like a pillow underneath your abdomen to start, but it is really important for spine health and spine mobility to be able to lay on your stomach. If you need to, you can start just laying on your belly like that. But from here, we want to work up to Closed position if you can. So we're working into that extension. So we've already worked the vertebrae kind of the other way. Now we want to work them back. So we're doing movement equally through both sides. We're not wanting to cause any kind of twisting or rotation because that's going to cause more pain and problems. So if you can hang out here, even for, 2, 3, 4, 5 minutes, even if it's comfortable, you can do that. Then we want to work into more of a dynamic stretch. So a press up, it's called. So you're going to push up, 3 to 5 second hold, come back down. And then my back is not doing any work. My arms are doing the work, my legs are relaxed. I'm breathing out as I come up. Relax down. So these ones you want to work up to being able to do about 10 reps as long as you're comfortable. All right, so now you've got some exercises, easy, gentle exercises. If you're really in a lot of really acute, really severe low back pain, some things you can try, if you're having trouble getting into your doctor, getting into a therapist, try these gentle exercises. If you can't go all the way into the movements, just do partial movements. Try and keep breathing, try and really let those muscles relax, because that's the biggest thing with back pain is the muscles spasm, and then you feel more pain, and then they spasm more, and it's just this vicious cycle. So the more you can get yourself to relax and relax those muscles, breathe into those muscles, get them to shut off, the more you're going to have less pain, and you're going to be able to kind of really pinpoint where your pain is coming from instead of just feeling like it's all over. So as much as you can, try to breathe, relax. If you feel like it is more of an inflamed, if it's a really hot pain, especially if you had some kind of injury and then all of a sudden you've got this back pain right away, use some ice. So 10 to 15 minutes of ice, lay on it, lay on your back with your knees up like we did in that pelvic tilt position, put pillows under your knees. That's going to let those muscles relax the best, and it should feel most comfortable for you with the legs up because that reduces that curve in your low back. A few little tips and tricks on low back pain, very common issue. I've dealt with it myself. So coming up next, I'll talk a little bit more about how to pinpoint where your back pain is coming from, and maybe a few other tips and tricks on how you can help fix it yourself. Thanks for watching, everybody. If you enjoyed this video, please share with your family and friends, subscribe so you can get more videos from me, and we'll see you next time.